Hello, and welcome to another edition of Orthopedic Sports Medicine Patient Educational Series with Dr. Adam Derhake. In this video, we're going to go through the details of the postoperative rehabilitation program following a knee arthroscopy with meniscectomy. A meniscectomy means that we had to go into the knee and arthroscopically remove a portion of your meniscus that's torn. Arthroscopically meaning doing so through two little poke holes in the front of the knee with a camera. This is an outpatient procedure. You go home the same day. You don't have to stay in the hospital. You can put 100% of your weight on the knee immediately following the procedure. I do give patients crutches initially following the procedure for the first 24 to 48 hours. This is a safety precaution only to ensure that you don't have a sudden increase in pain or buckling of the knee and fall. As you gain more confidence in the knee, patients usually are rid of the crutches again within the first day or two. We place some numbing medication around the two little poke holes, so after the surgery you should be relatively comfortable. I encourage patients, however, not to wait until the numbing medicine wears off to start taking the pain prescription. You will receive a pain prescription either prior to the operation in your preoperative clinic visit or on the day of your surgery. I encourage patients to start taking the pain pills, one pill every 4 hours as soon as they get home, regardless of how much pain they're in. That way, once that numbing medicine wears off, you already have the pain medicine in your system, and that way you're staying ahead of your pain. Patients that wait until they start to experience pain before taking their pain medication can find that they're playing catch up with their pain management. Once the numbing medicine is worn off and you know exactly how much pain you are going to be in, then I immediately recommend that patients start to spread out their pain medicine. So if 4 hours rolls around and you're doing okay, try to extend it to every 5 hours or 6 hours or 8 hours. You really only have to take the pain medicine as you need it, and less is more when it comes to pain medication. We will also give you an anti-nausea medication called Zofran. This medication is just in case you get sick to your stomach from the anesthetic and is not required unless you do get sick to your stomach. But it is nice to have just in case, because patients that have nausea as a result of the anesthetic care more about their nausea than they do their knee. On postoperative day number 1, you will return to my office for a review of your arthroscopic pictures so that we can show you exactly what we did and what we found. At that point, we will remove the large ACE wrap that's placed on the knee postoperatively, and we will go to 2 small little band-aids on the poke holes. We encourage patients to get small waterproof band-aids for the poke holes. With the waterproof band-aids in place, you can pretty much shower normally starting immediately on day 1 after the surgery. Although I think the waterproof band-aids are fine for showering, I do not recommend that they go underwater. So I have patients avoid any baths, whirlpools, or swimming pools while their wounds are still healing. On postoperative day number 1, we will also discuss beginning of formal outpatient physical therapy. As a result of a knee arthroscopy, the quadricep muscle really shuts down and becomes weak. And it is the weakness in the leg that determines how quickly patients bounce back from surgery. Because of this, I start patients in physical therapy immediately on day 1 after their surgery to work on quadricep strengthening exercises. Although the pain and swelling from the knee scope will improve within the first week or 2 following the procedure, the weakness can persist for a month or 2 after the procedure. At 2 weeks post-op, you return to my office with one of my nurse practitioners so that your sutures can be removed and your wounds inspected. At that time, my nurse practitioner will also check in to see how physical therapy is going and how you are doing with your ambulation. Most patients are walking fairly normally, unassisted, without crutches, within the first week following the procedure. At 2 weeks post-op, patients are continued with their formal outpatient physical therapy to continue to work on regaining the strength in the quadricep muscle. 1 month postoperatively, you return to the office to see me. At that time, we really assess where the strength and function of the quadriceps is, and we determine what, if any, additional physical therapy will be required. Patients that have had significant response with the initial month of physical therapy then transition to a home exercise program. Approximately half of my patients, however, require some additional work with the therapist in order to fully regain all the strength in their leg. This is important because patients that have persistent weakness in the leg are at a much higher risk for recurrent injury or pain. In terms of return to work following a knee arthroscopy, this is largely determined by the type of activities that are required at your job. For my patients that perform mainly desk work, they can have their procedure done on a Thursday and be sitting back on their desk on a Monday. However, patients that have more high demand activities such as my farmers, my laborers, my construction workers, these patients may take at least 2 weeks before being able to return to work. Even at 2 weeks, oftentimes they return to work with some form of work restrictions on the leg, such as no kneeling or squatting, no climbing of ladders, and we oftentimes will limit how much you can lift with the leg. Regardless of your job, by 1 month post-op, my expectation is that you will be able to return to work full duty with no restrictions on the leg. After returning patients to work full duty with no restrictions at 1 month, I then have patients return to my office at 2 months post-op to see how their transition back to work has gone. I also have patients who were sent back to formal outpatient physical therapy return to the office at 2 months post-op. This is to ensure that their strength and overall function completely returns to the leg. And long-term, I encourage patients to continue with their home exercise program to prevent recurrent pain as well as recurrent injury. The most common reason for patients to continue to have persistent pain or symptoms following their meniscectomy is due to underlying osteoarthritis. This we had previously discussed in detail in our general video regarding meniscal tears and meniscectomy. Once all function has returned and the symptoms have resolved, the patient is discharged and encouraged to return if their pain returns. I hope this video has helped you to better understand the postoperative rehab process following an arthroscopy with meniscectomy. This is one of the most common procedures that we perform in orthopedics. It is also one of the most successful procedures. Thank you and have a good day.